Question 1. In the context of breast ultrasound imaging, is the green a 50-year-old male presents with a palpable lump in his left breast? After conducting a thorough physical examination, you begin a focused ultrasound evaluation. Upon scanning, you notice a well-defined anechoic mass with enhanced posterior acoustic features. Given these findings, which of the following is the most likely diagnosis? A. Fibroadenoma. B. Malignant mass. C. Simple cyst. D. Lipoma. Answer. Correct answer. C. Simple cyst. Explanation. The key sonographic feature observed in this case is the well-defined anechoic mass with enhanced posterior acoustic features. This is typically consistent with a simple cyst, which is a benign lesion characterized by fluid-filled content. The enhancement of posterior acoustic features is a hallmark of a cyst due to the increased transmission of sound waves through the fluid. Fibroadenomas are solid masses with smooth borders but do not exhibit these specific acoustic features. Malignant masses B tend to have irregular margins, heterogeneous echogenicity, and may not show posterior acoustic enhancement. Lipomas D appear as well-circumscribed masses but are usually homogeneous in appearance and not as anechoic as cysts. Question 2. Given the circumstances, you are performing an ultrasound-guided core needle biopsy on a breast lesion. The lesion is located in the upper outer quadrant of the left breast, and you need to ensure that the needle is properly aligned with the lesion for accurate tissue sampling. Which of the following techniques is essential for optimal visualization and accurate needle placement during the procedure? A. Power Doppler imaging. B. Use of a second imaging plane for needle guidance. C. Color Doppler imaging. D. Continuous wave Doppler. Answer. Correct answer. B. Use of a second imaging plane for needle guidance. Explanation. The use of a second imaging plane for needle guidance is critical for ensuring accurate needle placement in ultrasound-guided core needle biopsy procedures. This allows for real-time visualization of the needle's trajectory and ensures that it reaches the lesion precisely. Power Doppler A is used to assess blood flow within lesions but does not aid in needle guidance. Color Doppler C and Continuous Wave Doppler D are valuable for assessing vascularity but are not specifically relevant to needle alignment. A second imaging plane provides the necessary depth and angle information for optimal biopsy success. Question 3. In light of recent developments, a patient presents with a palpable mass in her right breast. The ultrasound reveals a mass that is hypoechoic with irregular borders and posterior acoustic shadowing. Based on these findings, what is the most likely diagnosis? A. Fibroadenoma. B. Simple cyst. C. Malignant tumor. D. Abscess. Answer. Correct answer. C. Malignant tumor. Explanation. The combination of a hypoechoic mass with irregular borders and posterior acoustic shadowing is highly suggestive of a malignant tumor. Malignant lesions often display these features due to their dense and irregular structure, which leads to the attenuation of sound waves and results in posterior shadowing. Fibroadenomas are typically present as well-defined hypoechoic lesions with smooth borders. Cysts B are anechoic and do not produce shadowing. An abscess D could present with hypoechoic areas, but it typically has a complex internal structure which is not indicated in this scenario. Question 4. When analyzing the potential for artifacts during breast ultrasound imaging, you notice that the image quality is degraded by irregularities in the tissue interface. This phenomenon is most likely due to A. Acoustic impedance mismatch, B. Refraction, C. Doppler shift, D. Scattering. Answer. Correct answer A. Acoustic impedance mismatch. Explanation. Acoustic impedance mismatch occurs when there is a significant difference in the acoustic impedance between two tissues, causing reflections that can degrade image quality. This mismatch is common at tissue boundaries, leading to artifacts such as shadowing or enhancement. Refraction B can cause bending of sound waves, but it typically results in distorted images rather than degradation of tissue interfaces. Doppler shift C is related to blood flow assessment, while scattering D refers to the diffusion of sound waves in multiple directions, often affecting image resolution, but not primarily the tissue interface. Question 5. From the perspective of Doppler ultrasound in breast imaging when assessing a lesion's vascularity, which of the following is the most appropriate technique for identifying malignant characteristics? A. Continuous wave Doppler. B. Color Doppler imaging. C. Pulsed wave Doppler. D. Power Doppler imaging. Answer. Correct answer. B. Color Doppler imaging. Explanation. Color Doppler imaging is the most appropriate technique for assessing the vascularity of lesions in breast imaging. It allows for the visualization of blood flow, direction, and velocity, which can help differentiate malignant from benign lesions. Malignant tumors often exhibit increased and disorganized blood flow. Continuous wave Doppler A is used for high velocity blood flow but is not ideal. Imaging specific lesions. Pulse wave Doppler C is used for more precise measurements of blood flow velocity, while power Doppler D is sensitive to low velocity flow but does not provide as detailed an image as color Doppler. Question 6. Upon closer examination of a patient's breast ultrasound, you observe lesion that is hyperechoic with smooth, well-defined margins. It does not show any posterior acoustic features. Given this presentation, which of the following diagnoses is most likely? A. Malignant tumor. B. Fibroadenoma. C. Cystic lesion. D. Lipoma. Answer. Correct answer. B. Fibroadenoma. Explanation. Fibroadenomas are benign lesions that typically appear as hyperechoic, brighter than surrounding tissue, with smooth, well-defined borders. The absence of posterior acoustic features is also a characteristic of benign solid masses like fibroadenomas. Malignant tumors often have irregular borders and heterogeneous echogenicity. Cystic lesions C tend to be anechoic and demonstrate posterior acoustic enhancement, which is not seen here. Lipomas D are generally hyperechoic but typically have a more homogeneous appearance. Question 7. A 45-year-old woman presents for a breast ultrasound following a recent mammogram that showed a suspicious area in her right breast. The ultrasound reveals a mass that is solid, hypoechoic with irregular margins and posterior acoustic shadowing. Which of the following characteristics is most indicative of malignancy? A. Well-circumscribed margins. B. Hyperechoic appearance. C. Posterior acoustic shadowing. D. Smooth, oval shape. Answer. Correct answer. C. Posterior acoustic shadowing. Explanation. Posterior acoustic shadowing is a key sonographic feature that can indicate a malignant tumor. It occurs due to the dense and irregular nature of the tumor, which attenuates the sound waves and creates a shadow behind the mass, while circumscribed margins and a smooth, oval shape. D are typical features of benign lesions, while hyperechoic appearance B can be seen in fatty lesions but is not indicative of malignancy. Question 8. Based on the information provided, a 60-year-old woman is undergoing a breast ultrasound as part of a routine screening. The ultrasound reveals a round, well-circumscribed lesion that is hypoechoic with a thin echogenic rim. What is the most likely diagnosis for this lesion? A. Cyst. B. Fibroadenoma. C. Lipoma. D. Metastatic tumor. Answer. Correct answer A. Cyst. Explanation. The description of a round, well-circumscribed lesion that is hypoechoic with a thin echogenic rim is characteristic of a simple cyst. The thin echogenic rim corresponds to the fibrous capsule of the cyst. Fibroadenomas B are typically more solid and less defined in appearance. Lipomas C are also benign but are usually hyperechoic and homogeneous, unlike the hypoechoic cyst. Metastatic D are typically irregular with heterogeneous echogenicity and are less likely to have such a well-defined border. Question 9. Considering the evidence from clinical studies, a 35-year-old woman presents with a non-palpable mass detected during routine screening. The ultrasound reveals a solid, hypoechoic mass with irregular margins and an absence of posterior acoustic features. What is the most appropriate next step in management? A. Observation and follow-up ultrasound in 6 months. B. Biopsy of the lesion. C. Mammography for further evaluation. D. MRI of the breast. Answer. Correct answer. B. Biopsy of the lesion. Explanation. A solid hypoechoic mass with irregular margins in the absence of posterior acoustic features raises concern for malignancy. The next step in management is typically a biopsy to obtain tissue for histological evaluation, while mammography C, MRI D can be helpful in further evaluation. Biopsy is the definitive method for diagnosis. Observation is not appropriate. This case due to the suspicious nature of the lesion. Question 10. The primary reason for the use of ultrasound in breast cancer screening is A. It provides a clearer image than mammography. B. It is more effective at detecting microcalcifications than mammography. C. It is able to distinguish between benign and malignant lesions based on their echogenicity. D. It is a non-invasive, cost-effective imaging modality. Answer. Correct answer. D. It is a non-invasive, cost-effective imaging modality. Explanation. Ultrasound is often used as a supplementary imaging technique in breast cancer screening because it is non-invasive, relatively cost-effective, and useful for evaluating specific areas of concern detected on mammography. It can help distinguish between cystic and solid masses, but is not as effective as mammography for detecting microcalcifications. B. It does always distinguish definitively between benign and malignant lesions solely based on echogenicity. C. And although ultrasound is valuable, it does not necessarily provide clearer images than mammography. A. Question 11. Based on the information Ms. Thompson, a 42-year-old female with a family history of breast cancer, presents for a diagnostic breast ultrasound after suspicious physical examination. During the examination, the sonographer explains that the ultrasound image is produced by high-frequency sound waves propagating through the tissue. However, Ms. Thompson is curious to know why certain structures appear with enhanced brightness while others appear darker. In this scenario, which of the following principles is most responsible for the differences in echogenicity seen on her ultrasound image? A. Refraction of sound waves due to variable tissue densities. B. Scattering of sound waves from microscopic tissue interfaces. C. Absorption of sound energy converting to heat in tissue structures. D. Acoustic impedance mismatch at tissue boundaries. Answer. Correct answer. D. Acoustic impedance mismatch at tissue boundaries. Explanation. In ultrasound imaging, the variation in echogenicity, the brightness or darkness of structures, is predominantly due to differences in acoustic impedance between adjacent tissues. When sound waves encounter boundary between tissues with different acoustic impedances, portion of the wave is reflected back while the remainder continues forward. This reflection creates the shade seen on the ultrasound image. Although refraction may and scattering B contribute to image formation, they are not the primary reasons for differences in brightness. Absorption C does occur as sound energy is partially converted to heat, but it does not account for the distinctive echogenicity seen at tissue interfaces. The principle of acoustic impedance mismatch is key in understanding how tissues with varying densities produce the contrastness for diagnostic imaging as defined by the fundamentals of ultrasound physics and imaging guidelines. Question 12. Throughout the course of her routine examination, Isis Rivero, a 55-year-old patient, is informed about the role of ultrasound transducers in breast imaging. While discussing the procedure, the sonographer emphasizes the importance of transducer frequency selection in achieving optimal image resolution and tissue penetration. Considering the basic physics and clinical considerations of ultrasound, which of the following statements best describes the trade-off associated with using a high-frequency transducer in breast sonography? A. Higher frequency transducers offer greater tissue penetration at the cost of low resolution. B. Higher frequency transducers provide superior resolution with a limitation in tissue penetration. C. Low frequency transducers offer superior resolution but result in decreased image quality. D. Low frequency transducers are ideal for both high resolution and deep tissue imaging. Answer. Correct answer. B. High frequency transducers provide superior resolution with a limitation in tissue penetration. Explanation. High frequency transducers are known for their enhanced spatial resolution, which is critical in delineating the fine details of breast tissue and small lesions. However, these transducers have limited penetration depth due to higher attenuation of the sound waves. This trade-off is essential in breast imaging because the breast is a relatively superficial structure, thus benefiting from the high resolution that high-frequency transducers provide. Option A is incorrect because high-frequency waves do not offer greater penetration. Option C incorrectly inverts the concept, and option D is misleading because low-frequency transducers indeed penetrate deeper but at a cost of reduced resolution. According to clinical ultrasound guidelines and physics principles, the optimal selection of transducer frequency is crucial to balance resolution and penetration for accurate imaging. Question 13. Through careful analysis of her recent ultrasound exam, Dr. Ahmed is evaluating the technical aspects behind image formation and notices that certain areas of the sonogram exhibit diminished brightness despite the presence of tissue interfaces, given that the breast is composed of varying tissue types, which underlying concept most directly explains this observed reduction in signal intensity. A. Absorption of ultrasound energy converting to heat within the tissues. B. Increased acoustic impedance mismatch leading to high reflection. C. Enhanced refraction causing aberrations in the beam path. D. Elevated scattering diminishing the received signal strength. Answer. Correct answer. A. Absorption of ultrasound energy converting to heat within the tissues. Explanation. Absorption of ultrasound energy is the process by which sound waves lose energy as they pass through tissue, with that energy being converted into heat. This loss contributes to reduced signal intensity on the resulting image, leading to areas of diminished brightness, while increased reflection due to acoustic impedance mismatch. B. Plays a role in image contrast. It does not account for the loss of energy that manifests as darker regions. Enhanced refraction, C, and elevated scattering, D, can also alter the beam path and affect resolution, but are not the primary reasons for a reduction in signal intensity. Understanding these physical principles is essential in ultrasound physics, and adherence to safety guidelines requires managing energy deposition within patient tissues during imaging. Question 14. When presented with a complex imaging scenario, Mr. Lawrence, a 39-year-old male with a dense breast tissue profile, undergoes a comprehensive ultrasound evaluation. During the examination, the sonographer observes a linear artifact that seems out of place, running across the expected anatomical boundaries. Considering the nature of ultrasound artifacts, which of the following is the most likely cause of this artifact in Mr. Lawrence's imaging study? A. An acoustic shadow caused by calcifications. B. Reverberation artifact due to multiple reflections between strong reflectors. C. Mirror image artifact generated by reflection from a strong interface. D. Ring down artifact due to resonance in fluid collections. Answer. Correct answer. C. Mirror image artifact generated by reflection from a strong interface. Explanation. A mirror image artifact occurs when the ultrasound beam is reflected off a strong interface, such as a highly reflective tissue boundary, and then encounters another structure, producing a duplicate image that appears as though it is located in an abnormal position. This phenomenon is characteristic of complex tissue environments such as dense tissue, where strong reflective surfaces may mimic or produce additional lines on the image. Acoustic shadow A and ring down artifact D have different appearances and are typically associated with calcifications or fluid collections, respectively, while reverberation artifact B produces multiple, equally spaced echoes rather than a single mirror image. Recognizing these artifacts is essential for avoiding misinterpretation of images and is emphasized in best practice guidelines for advanced breast sonography. Question 15. In response to recent professional safety updates, Ms. Jenkins, a 48-year-old patient scheduled for a breast ultrasound, is briefed on safety protocols and potential adverse effects linked to prolonged ultrasound exposure. During the discussion, you emphasized that ultrasound is considered safe, yet certain precautions must be observed. Which of the following considerations is most critical to ensure patient safety during breast sonography? A. Maximizing ultrasound power to improve image resolution. B. Avoiding the use of ultrasound contrast agents in all cases. C. Employing higher frequency transducers to minimize tissue heating. D. Adhering to the ARRT as low as reasonably achievable principle. Answer. Correct answer. D. Adhering to the ARRT as low as reasonably achievable principle. Explanation. The ARRT principle mandates that all ultrasound examinations should use the minimum amount of energy necessary to achieve the required diagnostic image quality. This safety guideline is designed to minimize patient exposure to ultrasound energy and reduce the risk of tissue heating or other potential bioeffects, even though such risks are low. Maximizing power A is contrary to this principle, while the blanket avoidance of contrast agents B and the exclusive use of high-frequency transducers C are not universally applicable strategies for ensuring safety. The ARRT approach is a widely accepted standard in medical imaging and is reinforced by professional organizations and regulatory agencies to ensure that patient safety remains the foremost priority during ultrasound procedure. Question 16. When evaluating the sonographic layers of the breast in a detailed examination, Dr. Patel is using high-resolution imaging to identify the distinct tissue planes. During the scan of MS Walters, a 50-year-old patient, he is focused on differentiating between the mammary and retromammary layers. Which of the following imaging features is most critical for differentiating the mammary layer from the retromammary layer? A. The presence of posterior acoustic enhancement in the mammary tissue. B. The echogenicity and the presence of fibroglandular tissue in the mammary layer. C. The location of the pectoral muscle relative to the retromammary fat. D. The thickness of the subcutaneous fat layer overlaying both structures. Answer. Correct answer. B. The echogenicity and the presence of fibroglandular tissue in the mammary layer. Explanation. The mammary layer typically presents with a heterogeneous echotexture due to the mix of fibroglandular tissue and fat, while the retromammary layer is more uniformly hypoechoic, consisting predominantly of fat. Differentiating these layers is essential for accurate anatomical assessment and is achieved by carefully evaluating the tip characteristics, including echogenicity, texture, and the relative distribution of fibroglandular tissue. Although the relative location of the pectoral muscle, C, is useful in orienting the scan, the critical distinguishing feature lies in the inherent tissue echotexture. The subcutaneous fat thickness, D, and posterior acoustic enhancement, A, do not provide the same degree of differentiation between these layers. Such anatomical distinctions, vital for precise mapping during diagnostic examinations and surgical planning, is outlined by current imaging protocols and anatomical guidelines. Question 17. Considering the evidence from advanced Doppler applications, Mr. Richards, a 36-year-old male undergoing a targeted breast ultrasound for a palpable abnormality, is evaluated for vascularity using Doppler techniques. The radiologist is particularly interested in distinguishing the neovascularization that could indicate malignancy. Which Doppler technique is most appropriate for assessing subtle variations in blood flow within the lesion to support diagnosis? A. Continuous wave Doppler. B. Power Doppler imaging. C. Pulse wave Doppler. D. Color Doppler imaging. Answer. Correct answer. C. Pulse wave Doppler. Explanation. Pulse wave Doppler allows for the precise measurement of flow velocity and provides spectral analysis of blood flow within a lesion. This technique is especially useful in distinguishing neovascular patterns, which are often associated with malignant tumors. Continuous wave Doppler lacks the ability to localize flow to a specific region, while power Doppler imaging B is highly sensitive, does not provide velocity data. Although color Doppler D is effective in visualizing flow direction and overall vascularity, pulse wave Doppler is more adept at offering detailed quantitative information that can help differentiate between benign and malignant vascular patterns. This level of detail is critical in advanced breast sonography protocols and aligns with current guidelines for evaluating the microvascular architecture of breast. Question 18. In what ways can sonographic pattern recognition contribute to differentiating benign from malignant lesions in breast imaging? Ms. Campbell, a 40-year-old patient, presents with a small, non-palpable lesion discovered during routine screening. Her ultrasound study reveals a lesion that is solid with well-circumscribed margins and homogeneous internal echoes. Given these features, which of the following is the most likely diagnosis? A. Fibroadenoma. B. Malignant neoplasm. C. Simple cyst. D. Abscess. Answer. Correct answer A. Fibroadenoma. Explanation. Fibroadenomas typically present as solid, benign lesions with well-circumscribed margins and homogeneous echotexture on ultrasound imaging. This is consistent with the classic sonographic features observed in many benign breast conditions. In contrast, malignant neoplasms B often exhibit irregular margins, heterogeneous echotexture, and may show posterior acoustic shadowing. Simple C appear anechoic with posterior enhancement, and abscesses D are usually associated with complex internal echoes and clinical signs of infection. Recognizing these patterns is essential for accurate differential diagnosis in breast sonography, as established by the BI-RADS lexicon and current imaging best practices. This skill not only facilitates precise diagnosis, but also helps in planning appropriate patient management and further interventions. Question 19. In response to emerging trends in minimally invasive procedures, Dr. Chen is performing an ultrasound-guided wire localization for A small, non-palpable breast lesion in Mrs. Morrison, a 53-year-old patient. The procedure requires precise coordination between imaging and interventional techniques. Which of the following steps is most crucial for ensuring accurate wire placement during the localization procedure? A. Using only a single imaging plane for optimal spatial orientation. B. Avoiding the use of color Doppler to prevent artifact generation. C. Relying solely on tactile feedback from the needle insertion. D. Real-time adjustment of the wire guidance under dual-plane imaging verification. Answer. Correct answer, D. Real-time adjustment of the wire guidance under dual-plane imaging verification. Explanation. Accurate wire localization of a breast lesion requires the operator to continuously visualize the needle and wire trajectory in real time using dual-plane imaging. This approach ensures that the device is correctly positioned relative to the lesion from multiple angles, thereby minimizing the risk of misplacement. Using only an imaging plane A may lead to spatial misinterpretation, and relying solely on tactile feedback C is inadequate without visual confirmation. While color Doppler B can be useful in other settings, its exclusion here does not contribute to precise localization. The integration of dual-plane imaging techniques adheres to advanced interventional protocols and is supported by guidelines from radiological societies to ensure both diagnostic accuracy and patient safety during such procedures. Question 20. To better understand the challenges in correlating ultrasound findings with other diagnostic modalities, Octelu is reviewing the case of Esther Hernandez, a 47-year-old patient with a suspicious lesion identified on both ultrasound and prior mammography. The ultrasound reveals a lesion that is solid, hypoechoic, and with partially indistinct margins. In integrating the imaging data from both modalities, which of the following approach is most effective in guiding further management of the lesion? A. Rely exclusively on the ultrasound findings due to its high resolution. B. Utilize a combined assessment of ultrasound and mammography findings to formulate a differential diagnosis. C. Dismiss the mammographic results as overestimated due to potential artifacts. D. Schedule an immediate MRI without revisiting the ultrasound data. Answer. Correct answer. B. Utilize a combined assessment of ultrasound and mammography findings to formulate a differential diagnosis. Explanation. Integrating findings from both ultrasound and mammography is essential to obtaining a comprehensive evaluation of breast lesions. Each modality offers unique information. Ultrasound excels in characterizing lesion margins, internal architecture, and vascularity, whereas mammography is particularly effective in detecting calcifications and overall breast architecture. By combining the strengths of both imaging studies, clinicians can better differentiate benign from malignant lesions and decide on the most appropriate intervention. Relying solely on one modality A or dismissing either C could result in misdiagnosis. Unnecessary interventions. Immediate MRI should be reserved for cases where further clarification is required after thorough combined assessment. This integrated approach aligns with current best practices and accreditation standards, ensuring that patient management is both evidence-based and individualized. Question 21. During the ultrasound examination of MS, Carter, a 58-year-old patient, the sonographer observes a small, solid mass with irregular margins located in the upper outer quadrant of the breast. The lesion has a heterogeneous echogenicity. Which of the following characteristics would most likely suggest that this lesion is benign? A. The lesion is highly irregular with a heterogeneous echo pattern. B. The lesion shows well-defined, smooth margins with homogeneous echogenicity. C. The lesion demonstrates posterior acoustic shadowing. D. The lesion shows increased vascularity on Doppler imaging. Answer. Correct answer. B. The lesion shows well-defined, smooth margins with homogeneous echogenicity. Explanation. Benign lesions such as fibroadenomas or cysts typically present with well-circumscribed, smooth margins and homogeneous echogenicity. An irregular shape with heterogeneous echotexture is more characteristic of malignant lesions, while posterior acoustic shadowing C is often seen in calcified or fibrotic lesions, which are benign but are not definitive indicators. Increased vascularity D can be a feature of malignancy but does not alone confirm a benign diagnosis. Recognizing these patterns helps to guide further clinical management and biopsy decisions. Question 22. A 46-year-old patient presents with a palpable mass in the left breast. On ultrasound, a hypochoke mass with irregular borders is observed. The lesion shows no posterior acoustic enhancement and demonstrates increased vascularity on Doppler imaging. Based on these findings, which of the following is the most likely diagnosis? A. Fibrocystic change. B. Breast carcinoma. C. Fibroadenoma. D. Lipoma. Answer. Correct answer. B. Breast carcinoma. Explanation. Breast carcinoma often presents as a hypochoic mass with irregular borders, lack of posterior acoustic enhancement, and increased vascularity as seen in the Doppler study. These features are indicative of a malignant tumor. Fibrocystic changes are typically present with multiple cysts and homogeneous areas, not irregular masses. Fibroadenomas, C, are often well defined and have a regular shape. Lipomas, D, are benign fatty tumors that usually appear hyperechoic or isochoic to the surrounding tissue. A malignant lesion with these characteristics warrants further evaluation, including biopsy. Question 23. MS. Winters, a 65-year-old patient, has a history of breast cancer and is undergoing a follow-up ultrasound to monitor for recurrence. During the scan, the sonographer notices a lesion in the subareolar region that is well circumscribed and homogeneous in appearance. Which of the following is the most likely diagnosis for this lesion? A. Invasive ductal carcinoma. B. Cystic lesion. C. Benign fibroadenoma. D. Phyllodes tumor. Answer. Correct answer. C. Benign fibroadenoma. Explanation. A well-circumscribed, homogeneous lesion is most likely a benign fibroadenoma. Fibroadenomas are common, especially in older women, and typically have smooth margins with uniform echogenicity. Invasive ductal carcinoma are usually present with irregular margins, hyperechoic areas, and heterogeneous echogenicity. Cystic lesions, B, appear anechoic and may have posterior acoustic enhancement. Phyllodes tumors, D, can also present as large, well-defined masses, but are less common and may have a more heterogeneous texture. Question 24. In assessing a patient with a suspicious breast lesion, Dr. Parker utilizes ultrasound-guided biopsy to obtain tissue samples. During the procedure, the radiologist is focused on minimizing potential risks of bleeding and infection. Which of the following is the most important factor in ensuring a safe and effective biopsy procedure? A. Using the highest power setting on the ultrasound machine. B. Properly sterilizing the biopsy site and surrounding skin area. C. Choosing the largest available biopsy needle for the procedure. D. Performing the biopsy without applying local anesthesia to avoid complications. Answer. Correct answer. B. Properly sterilizing the biopsy site and surrounding skin area. Explanation. Sterilization of the biopsy site is essential to prevent infection and ensure a safe and successful procedure. Inadequate preparation of the biopsy area can lead to complications such as infections. The ultrasound power setting A should be appropriate but not excessively high, as it can cause tissue heating. Choosing the correct biopsy needle size is important, but using the largest needle C may not always be necessary or appropriate. Local anesthesia D is typically used to ensure patient comfort and reduce the risk of procedural complications, so performing the biopsy without it is not recommended. Question 25. A 62-year-old patient presents with a palpable mass in the breast. An ultrasound reveals a round anechoic structure with well-defined borders and posterior acoustic enhancement. Which of the following is the most likely diagnosis? A. Simple cyst. B. Invasive carcinoma. C. Fibroadenoma. D. Abscess. Answer. Correct answer A. Simple cyst. Explanation. A simple cyst is typically an anechoic structure with smooth, well-defined borders and posterior acoustic enhancement, which is a common characteristic of cystic lesions. Invasive carcinoma B would more likely present with irregular borders, heterogeneous echogenicity, and no posterior acoustic enhancement. Fibroadenomas C may be solid and appear hypoechoic, and abscesses D may with complex internal echoes and signs of infection. Simple cysts are benign and commonly encountered in breast imaging. Question 26. MS. Graham, a 49-year-old woman, has a routine ultrasound as part of her annual breast screening. The ultrasound reveals a hypoechoic lesion in the outer quadrant of the breast with irregular margins and some internal echoes. Which of the following is the next best step in management? A. Follow-up ultrasound in 6 months. B. Core needle biopsy for histopathological examination. C. Immediate mastectomy. D. Referral for breast MRI for further evaluation. Answer. Correct answer. B. Core needle biopsy for histopathological examination. Explanation. A hypoechoic lesion with irregular margins and internal echoes raises concern for a malignant process such as carcinoma. Core needle biopsy B is the next best step to obtain a tissue sample for histopathological examination and determine whether the lesion is benign or malignant. Follow-up ultrasound A is not appropriate in this because of the suspicious nature of the lesion. Mastectomy C is premature and should not be performed without a definitive diagnosis, while breast MRI D can be helpful for certain lesions. A biopsy is typically required to confirm the diagnosis. Question 27. During a routine screening of 40-year-old patient presents with a suspicious lesion on ultrasound, the lesion is hypoechoic, irregular, and demonstrates significant internal vascularity on Doppler. Given these findings, which of the following is the most likely diagnosis? A. Cyst. B. Lipoma. C. Fibroadenoma. D. Malignant tumor. Answer. Correct answer. D. Malignant tumor. Explanation. A hypoechoic irregular lesion with significant internal vascularity on Doppler imaging is highly suspicious for malignancy. These features are commonly seen in invasive carcinomas. Cysts A are typically anechoic and do not show internal vascularity. Lipomas B are benign and appear hyperechoic or isochoic. Fibroadenomas C are often well defined and show little vascularity. These ultrasound features warrant further evaluation and possibly biopsy to confirm malignancy. Question 20. During a breast ultrasound exam, the radiologist notes a lesion in the outer quadrant of the breast that exhibits a round shape and smooth borders. The lesion appears homogeneously hypoechoic with no significant vascularity. Which of the following is the most likely diagnosis? A. Breast carcinoma. B. Fibroadenoma. C. Cyst. D. Intraductal papilloma. Answer. Correct answer. B. Fibroadenoma. Explanation. Fibroadenomas are benign breast lesions that are typically present with smooth, well-defined borders and a homogeneous echo texture. The lack of vascularity and the round shape are consistent with a benign lesion. Breast carcinoma A often has irregular margins, heterogeneous echo texture, and vascularity. Cysts C are usually anechoic and exhibit posterior acoustic enhancement. Intraductal papillomas D are usually complex and may have mixed echogenicity. Question 29. A 55-year-old patient with a family history of breast cancer undergoes a breast ultrasound to investigate a palpable mass. The ultrasound reveals a hypoechoic mass with irregular borders and increased blood flow on Doppler imaging. What is the most appropriate next step? A. Follow-up ultrasound in 1 year. B. Core needle biopsy to obtain tissue for histopathology. C. Referral for breast MRI to confirm the diagnosis. D. Immediate mastectomy. Answer. Correct answer. B. Core needle biopsy to obtain tissue for histopathology. Explanation. A hypoechoic mass with irregular borders and increased vascularity is suspicious for malignancy. The next appropriate step is to perform a core needle biopsy. B. To obtain tissue for histopathological examination. Follow-up ultrasound A is not appropriate due to the suspicious nature of the mass. Referral for MRI. C can be considered. Biopsy results, but biopsy is needed for a definitive diagnosis. Mastectomy D is premature without confirmation of malignancy. Question 30. A 62-year-old patient with a history of benign breast disease presents for a routine breast ultrasound. The ultrasound reveals a small round anechoic lesion with smooth borders and posterior acoustic enhancement. What is the most likely diagnosis for this lesion? A. Simple cyst. B. Lipoma. C. Fibroadenoma. D. Breast carcinoma. Answer. Correct answer A. Simple cyst. Explanation. A simple cyst typically appears as an anechoic structure with smooth, well-defined borders and posterior acoustic enhancement. This is a classic feature of a benign cystic lesion. Lipomas, B, are benign fatty tumors, but usually appear hyperechoic or isoechoic to surrounding tissues. Fibroadenomas, C, are solid benign tumors, often hypoechoic. Breast carcinoma, D, would typically present regular borders, heterogeneous echogenicity, and no posterior acoustic enhancement.